Hello, Ms. Connor. What we'll be discussing today, my informative speech will be on CT, oral, and IV contrast. As you can see here now, I'm standing against a CT machine. CAT scan machine is what is clinically known as, but for short we call it CT. And some people get it mixed up with an MRI machine. They work totally different. One, the CT machine obtains images by radiation. The MRI machine obtains images by a huge magnet. Now, with that being said, the CT machine, we use oral and IV contrast. It gets kind of confusing because a patient might come in and say that the doc told them they were not getting that contrast. They might be thinking about the oral barium or gastrografin. With the oral barium or gastrografin, we use them in two different ways. One, we can use rectally as well as orally. Now, with using orally, what it does is coat your stomach, intestines, your colon, as well as your esophagus. And it's opacified, and so therefore, with it being opacified, the radiation cannot penetrate through, so it lets the doc see any abnormalities. Now, with the IV contrast, it's an iodine-based contrast solution which we inject intravenously. We'll start in IV, we shoot the contrast through your veins, it goes down and circulates through your heart, go all the way through your limbs, through your organs, and come back up through your veins. And what it does, it helps highlight the blood vessels, it highlights the organs, so the docs can get a good look at your organs as far as your liver, your spleen, your kidneys, and that kind of thing. And it tells if there's any other abnormalities. Now, with the IV contrast, sometimes you might get a warm feeling inside, the sensation to make you feel like you have to urinate, a little flush feeling, but it only lasts a few seconds. With the oral contrast, it might give you a little constipation, or sometimes with some patients, it gives them a feeling like they have to go to the bathroom, diarrhea feeling. But both of them, and once we have the oral prep, it takes like 2 hours. They give you instructions for you to drink the oral barium. You'll have to go on a fast for about, I say, a day before. Then you'll drink the oral barium with over a 2 hour period of time. And then that's when we'll bring you into the scanner. We'll start the IV and we'll start the injection. This is the power injection we use for the IV contrast. And after that, you have yourself a set of beautiful CT images. And they are done not superimposed, but in a slice section. They take each section of the area of interest. And then the doctor have a good set of films that he can read and give you a diagnosis. This information I had drawn from the Mayo Health Clinic online, as well as eMedical Diary online, Merrill's, which is a set of radiological textbooks that we use, as well as Women's Health online, and one more thing I checked on. That was it. Thank you. Hope I was very informative to you, and have a wonderful day.